Our patient today is Edna Meyer, a 62-year-old female, height 5'1", weight 155 pounds or 70 kilograms, and BMI of 29.28, which is considered overweight. The patient is in the hospital today due to a GI bleed, resulting in the need for a colonoscopy and diagnosis of diverticulosis and sigmoid colon bleed. So the colonoscopy is simply when a long flexible tube with a video camera at the end of it is inserted through the rectum into the colon so that the inner lining of the colon can be observed. Diverticulosis is the formation of pockets in the colon wall, usually as a result of chronic constipation. So as you can see from this picture here, the muscles are contracting around what is a very hard piece of stool, and after a while the lining of the colon is weakened, and at those weakened points it can push through and form these pockets or diverticula. So the diverticula can then start trapping particles like the seeds and pieces of nuts and stool, which can cause inflammation of those pockets, resulting in diverticulitis. So for the diverticulitis, the patient's currently on several antibiotics. She's on metronidazole, which can cause nausea, epigastric distress, diarrhea, and leave a metallic taste in your mouth. So that's not very appetizing, and that's something we'd want to keep an eye on for her intake. As well as the other antibiotic, which is ciprofloxacin, which can cause nausea as well, and cannot be taken with milk or high calcium foods, as that inactivates the antibiotic, and that's something the patient should be made aware of as well. She's also on a D5NS infusion at 50 cc's an hour. This is providing her with 1.2 liters of fluid and contains dextrose. That's what the D5 is. So it's simply a 5% dextrose solution in normal saline. It's providing her with 60 grams of dextrose and then the normal saline solution as well, which is hydrating her. Her labs are all considered within normal limits, and we're assuming that she had adequate hydration and was not overhydrated when these labs were taken. So just looking at the food and nutrition related history briefly, she has a pretty complete history. This is her usual intake. She's choosing things like white toast. We're assuming that white toast is also going on her sandwich. She only eats maybe 1 to 2 vegetables a day. There's really no fruit in here at all. She's drinking several cups of coffee a day, at least 3 or 2 to 3, depending on if she switches the iced tea for the coffee. She enjoys cooking and baking for herself and with her granddaughters. She indicated that she's chronically constipated, which is a trigger for the diverticulosis, and she treats that with prune juice. So that indicates she does have a little bit of knowledge about controlling her constipation, but based on her choices, she needs some education about fiber content in foods. And she has no known food allergies at this point in time. Moving down to her family history and her medical history, again we see the chronic constipation, and she also has hypertension. Her father died of colon cancer, so that's another risk factor of the diverticulosis, and her mother died of ovarian cancer, so both parents have this cancer in their background, so it's something we'd also want to keep an eye on for the future of this patient, but at the moment it's not too pertinent. The patient works from home as a seamstress and likes to bake and cook with her granddaughters. And these are 2 things we want to just keep in mind as we're educating the patient and determining her needs. A home seamstress is a pretty sedentary occupation, and just keeping in mind that she does like cooking. We want to make sure we address that in her education. So looking at her caloric needs, they were calculated using Mifflin St. Jeor with an activity factor of 1.4, which is considered the upper end of the sedentary activity factors, simply because she is under some stress at this point with the diverticulosis and the GI bleed. Potentially she has diverticulitis, but that wasn't specifically diagnosed in her history. So we determined that she has 1,700 calories per day needed. Her protein needs again were increased a little bit based on her stress from her current condition. So it was calculated using 1 to 1.2 grams per kilogram, which gave us 70 to 84 grams per day. And her fluid needs are going to be higher with the diverticulosis for preventing constipation. The International Foundation for Functional Gastrointestinal Disorders, as well as Nutrition and Diagnosis Related Care by Escott Stump, both recommend 2 to 3 liters of fluid per day. Using the 30 milliliters per kilogram of fluid per day, we got 2.1 liters, which falls within that range. But we just want to emphasize, because this patient's drinking, maybe only with meals, she seems to be dehydrated or potentially dehydrated. Her current diet order is NPO, but she is getting some calories from her D5NS solution. Just take note of that. From her food and nutrition related history, we can assume she feeds independently because she does bake for herself. We're assuming she can feed herself as well. There's no oral problems noted in her medical history, and we're not certain of her intake at this point, as we haven't seen her eat in the hospital since she's been diagnosed with these conditions. So moving on to the nutrition diagnosis, she was diagnosed with inadequate or suboptimal fiber intake related to lack of food knowledge and new diagnosis of diverticulosis, as evidenced by her chronic constipation and her 24-hour recall, indicating the patient chooses the refined starches, low fiber foods, and only eats 1 to 2 servings of vegetables a day. So moving on to our recommendations, we want low residue for now. That's suggested for diverticulitis, which again, she wasn't specifically diagnosed with that in her patient information, but because of the GI bleed as well, and the fact that she's on several antibiotics, we can assume she's got some sort of inflammation going on down there, and we want to reduce the bulk going through there. So, as recommended by the International Foundation for Functional Gastrointestinal Disorders, we want to reduce the amount of fiber she's getting currently, and reduce the particulates that she's eating. So no nuts, seeds, and the peas and corn, because they have those thick skins that you can't peel off. We don't want that getting caught in those pockets. But then we want to gradually increase the fiber to 25 to 30 grams per day, which is also recommended once she's out of the inflamed state. That's recommended by the International Foundation for Functional and Gastrointestinal Diseases, as well as Nutrition and Diagnosis Related Care by Escott Stump. And that's going to be over 3 weeks. We don't want to add it all in there all at once, or else she's going to get this big bulk, and that's just not going to be helpful to the patient. So the food and nutrient delivery is going to be oral. She needs to be educated on low to high fiber diet, be able to identify things that contain fiber and when to have low fiber in her diet when she has this inflamed state, and then when to transition up and how to transition up to the high fiber. We want to make sure we educate her on avoiding the nuts, seeds, popcorn kernels, anything that has those small particulates, as well as the food and nutrient interaction with milk and calcium containing foods and ciprofloxacin. So counseling, we want to make sure we're taking her needs into account here. We need to let her know what some high fiber recipe substitutions are, because she made that clear that that is something that she likes doing. We want to review things within her 24-hour recall and her usual intake, and just show her how to substitute those high fiber choices into her daily intake. Just explaining her goal of 25 to 30 grams of fiber daily once we transition her up, and making sure she's staying adequately hydrated to prevent constipation as well. And as far as coordination of care, we just want to make sure we're on the same track with the GI doctor. transitioning her from the low to high fiber once she's okayed and cleared for the diverticulitis or her GI bleed at this point. Goals are for the patient to be able to identify high fiber foods and high fiber recipe substitutes, and then decrease instances of constipation. So we want the patient to be able to identify, meat and dairy as not being fiber containing, identify fruits, vegetables, grains as fiber containing foods, and we want her to be able to list 2 to 3 recipe substitutions to increase fiber content in her baked goods. And we want to decrease instances of constipation, and we would indicate that by having the patient report how often she's having bowel movements, what's the consistency, and she should be having bowel movements daily of a soft consistency, not hard pellets. And these are just the references used to make recommendations to this patient.